Okay, so we're going to start with a demonstration on our model. This is Bob. We always call this guy Bob over here. And what we were just saying is initially like the evaluation. Okay, so usually what I do is I start talking to the patient, kind of find out, what area bothers them, what area they would like to do. Usually they tell you. Usually they say, well, I just want you to work on the forehead, or the crow's feet is an area that bothers me. Okay, so that's fine. Find out what area, and then you're going to go from there. And what I was just saying is that sometimes they're going to say, well, what do you think, doctor, or nurse? What do you think? What's your opinion? And try to give them their opinion. Say, well, I think we can smooth out the lines over here a little bit. I think the glabella region we could do a little bit. Ask them about the crow's feet. Say, there is a small line over here underneath your eye. Would you like me to, soften that a little bit? So you can definitely do that. All right. Once you have your idea of what you're going to do, you're going to work on the forehead lines. You're going to work on the glabellar, the crow's feet. You're going to write that on the chart. Okay. And you're going to document on the chart so you know for the next visit. You're going to do 4 units here, 2, and you're going to write that down exactly how it is. And remember we talked about of course you remember, the 2 visit, okay? So on your chart, you're going to document, you're going to rate the lowest amount of Botox that's going to give a good result. And you're going to explain that to the person, and they'll be very happy. They're going to save money, but, up in this area, on that first visit, you may only do 12 units. All right, and they're only going to pay, if you're charging $10 a unit, 10 times 12 is $120. So you're going to give them a good effect, all right, but they may need a little bit more. So the purpose is they come back 7 to 10 days later, and you do a little bit more of a touch-up, okay, and then you charge them the additional on the second visit. Okay, but a little bit about technique. Okay, so I started to say that after you get your markings down, so you decided you're going to do, let's just say, 20 units up here on the forehead. You're going to do 20 units in the glabella region, 20 on this side where the crow's feet are, and 20 on this side. So what you do is you get your syringes ready. You prepare each syringe. So that's going to be, each 0.1 is 4 units, times 5 that's 20 units. Then you get another syringe, and you line up your 1, 2, 3. You have 4 syringes ready to go. All right, and the reason why you do that, there's a couple reasons. One is that you've got a really sharp needle for every area, because the needle definitely dulls, and it starts to hurt them. So you're going to have a fresh needle throughout the whole time. Okay, that's number 1. Number 2, especially like for smaller people with small hands, it's easier to work with, this much in the syringe, rather than like having this syringe all the way out here. Your fingers may not be big enough, so you're only gonna work with half. Okay, so set up all those syringes. Remember what I was telling you also too, when you're working on your needle and your syringe behind the patient, you walk up to him, you keep this hand over here, and you talk to him like this. Then when you're ready to inject, so now let's say we're going to inject the crow's feet first, and now you could go like this, okay, and then you could come over here, and then you could inject on the sides like this. Okay, so 1, and then you just go right around. Okay, so that's how you do the crow's feet. Okay, we're going to show you on a person in a second, but you go right around the side like that. See how I'm kind of pulling the skin taut like that? That's important. Okay, we're going to do this area right in the middle, and again the technique, that's the pinch technique. So you just go like this. But what I would like to see right now is if you guys could just kind of come around one by one. I want to kind of show you a little bit how to brace your hand, because that's important. If you go in like this, you're not going to really, even if you go in like this, your hand is going to shake a little bit. So I want to see how everybody's going to brace and secure their hand. So what we're talking about right now specifically is how to inject and keep your hand stable. So there's a couple different ways that you could do this correctly. Okay. All right, one is, okay, so let me see, palpate the corrugator muscle, okay, and pinch okay, perfect. Now, come in, put your pinky somewhere on your own hand. Okay, that's a good place. How does that feel to you?
It feels too short because my fingers are too long.
Okay, move it somewhere around. Try a couple different areas.
It has to get back.
So believe it or not, the fact that her pinky is touching her hand like that stabilizes her whole hand.
I can't get it in there. My hand's too big. I have to go back. But that's
okay.
It's really good.
Let me try it here. Let me just show you something. Okay. So I mean, you could rest your pinky anywhere on the hand like this. What do you mean you have to go back like that? Yeah. Really anywhere.
Okay.
On your finger could be good. Or you could try resting it over here if you want. Okay. But the idea for now at the training session here is just to practice it. This is where you learn it, not, next week when you're doing it.
Right.
So you're doing this now for the first time.
Mm-hmm. Same thing here.
Yeah, that's good.
Now
it's not quite, you're not quite out that far. Closer to your hand, closer to your finger. Yeah. You don't want to put the crow's feet out that far. That's good. That looks good right there.
I'm still kind of, it's almost like,
Yeah, keep doing it until you start to feel good at it, you know? Okay, how about,
it's like you can lightly put this down.
that's another technique to do it, is just to we
guide
have that in
over your
so,
finger.
right, exactly, where you're just doing it like a pool cue, almost. So try that. Let's see you do like up in here. That actually looks good. I don't know how it feels for you, but that technique looks pretty good.
Actually feels natural.
How does that feel?
Feels good. I
Okay.
just need to set this down
Okay,
first.
so she feels comfortable just resting the hub on another finger.
I just need to rest.
The other thing is be
Round.
careful. I see a lot of people doing this, how you hold the syringe. Try to keep it as a one-handed technique like this. Some people, here, can I borrow the syringe again? Thanks. I see some people holding it like this, all right, and then it requires they go like this, then they have to come around with this hand. I see a lot of nurses. It's not that it's wrong, all right, it's just that it may be easier just to do it one-handed technique like this. And before we do it, on a live patient, you guys want to kind of practice a little bit with this model just to get the feel of it. And any one of these techniques is correct as long as it feels comfortable for you. Yeah. I don't know. That doesn't.
Awkward?
Yeah. How does that look to you? That didn't look too good.
Doesn't look awkward. Okay, so then what would you say?
Okay. Try. Well, squeeze in here like this.
You want me to squeeze
Yeah.
it, too?
Squeeze in here, in the middle.
He's heavy.
Yeah. And then that's it. And then rest your fingers on your other hand. That looked good. How does it feel?
Feels good.
Okay.
So you just really need to know what to do with where you're grounded everywhere.
Yeah, that's looking good now. Okay, let's see you do the forehead. Yeah, that's good. Okay, that's very good. All right, let's see if you remember where to inject the mentalis muscle.
Okay.
Let me help you out here a little bit. Okay, how much are you going to inject? What dosage?
5 and 5.
Okay, 5 and 5. That sounds good.
Now, do I need to? I don't
Just
have to,
try a couple different ways.
Well, my
And I'll tell you if it looks good. That looks good. Yeah, that's good. I would do it, though, a little bit more like right in the middle of the chin. Yeah.
Okay.
Like right there.
So not really in the knee, but more for the bone and up?
Yep, yeah, right in here.
Okay. And aim up.
Okay, yep, that's perfect, just like that.
Okay.
Okay, so that was I just wanted you guys to practice a little bit, and we're going to do that right now. Just kind of practice with the needle and the syringe before we actually start work on somebody. So we're going to all do that. Okay, that's good.
Thank you.